Hi, I'm Dr. Dan Orcutt, an orthopedic surgeon who's helped over 1,000 people recover from shoulder surgery. And if you've recently had surgery or you're planning for it, there's one question that always comes up. When can I drive again? It's one of the most common and most misunderstood milestones in shoulder recovery. And it's not as simple as when the pain goes away or once you're off meds. In this video, we're going to break down everything you need to know about returning to driving safely, without risking your shoulder or putting yourself in danger on the road. And before we get into it, I want to hear from you. Drop a comment below and let me know. Are you currently driving? Or are you waiting to be cleared? Now let's get into it. Let's start with the short version. For most patients, you can't drive while you're still wearing a sling. And depending on your surgery and recovery, it may be 4 to 6 weeks or even longer before you're fully cleared. But there's more to it than just getting the sling off. So let's unpack this properly. First up, why does driving matter so much? Driving is about independence. It's about getting your life back. Whether it's picking up groceries, seeing friends, or just not relying on someone else to get you places, it's a huge mental milestone. But it's also a high-risk activity after shoulder surgery. Even if you think you can manage the wheel or turn the key, here's what you're actually asking your body to do. You need shoulder strength, range of motion, coordination, and quick reaction time, all working together. That includes reaching the steering wheel comfortably, turning the wheel forcefully in an emergency, looking over your shoulder without strain, responding instantly if a car cuts you off. So when we talk about driving clearance, we're not just talking about your comfort, we're talking about your safety and liability. Next, let's talk about surgery types. Driving clearance varies depending on the type of surgery you've had. Here's a quick overview. If you had a rotator cuff repair, you'll likely be in a sling for 4 to 6 weeks. Driving is generally restricted until you're out of the sling and have regained some strength and control in that arm. If you had a total shoulder replacement, it's similar, often 6 to 8 weeks, but depending on your strength, it may be longer. If you had a labral repair, driving restrictions are usually longer, but again, this depends on surgeon preference and your progress. For a fracture fixation or more complex reconstruction, like a reverse total shoulder or SCR, clearance may be delayed even longer, sometimes up to 8 weeks. Bottom line, the timeline is not one size fits all. So how do you know when you're ready? Here are a few practical checkpoints I use with my own patients. First, are you out of the sling and moving your arm freely without pain? Second, can you grip the steering wheel with confidence, not just holding it, but actually turning it sharply without guarding? Third, can you react quickly in a simulated scenario? For example, if your hand is on the wheel and someone shouts, "Stop," can you turn or brake immediately without hesitation? If the answer to any of those is no or "I'm not sure," you're probably not ready. And finally, would you feel confident driving your grandchild to school or reacting in traffic? If not, take a little more time. Because when it comes to driving, probably okay isn't good enough. Now let's talk about legal and liability risks. This is something a lot of people don't realize. If you're driving while wearing a sling, or before your doctor has cleared you, and you're involved in an accident, you could be held legally responsible, even if the crash wasn't your fault. Insurance companies can deny coverage if you're found to be physically impaired or violating post-op restriction. And if you injure someone else, that's a nightmare scenario, not just medically, but legally and financially. So even if you think you can drive, remember, the legal consequences of driving too soon can be far more painful than waiting another week or two. Now, before we get into the logistics of returning to the driver's seat, let's talk about something I see all the time. And that's the emotional pressure to drive before you're really ready. A lot of patients feel frustrated or even embarrassed when they still need help getting around several weeks after surgery. They'll say things like, "I feel like a burden," or "I hate relying on people to drive me everywhere." And I get it. Driving is tied to independence. It feels like freedom. So when you can't do it, it feels like you're stuck or even falling behind. But here's the thing, driving early isn't a sign of strength or progress. It's a risk. And it's not just about your shoulder, it's about your safety and everyone else's too. I always remind my patients the ability to drive safely isn't about comfort, it's about control and reaction time. If you can't brake hard, turn quickly, or check your blind spot without hesitation, then it's just not worth it yet. You only need one close call to realize you came back too soon. So if you're feeling anxious about not driving yet, that's normal. So is asking for help. So is taking a few extra days, or even weeks, to be sure you're ready. Give yourself permission to wait. Your body will thank you for it. Let's shift gears for a moment and talk about a few practical tips for when you are cleared to drive. Tip 1. Start with short, familiar routes, like the grocery store or a friend's house. Tip 2. Drive in daylight. Nighttime driving adds extra complexity with visibility and reaction time. Tip 3. Use a small folded towel or soft support between your shoulder and the seatbelt to reduce pressure on the surgical area. And here's something I recommend to a lot of my patients. Consider using a seatbelt reacher tool. It's a simple device that attaches to the seatbelt and brings the buckle closer, so you don't have to twist, reach, or strain your healing shoulder to pull it across. I'll link it in the description if you want to check it out, along with where to find the product itself. Tip 4. Adjust your seat height and angle to give your shoulder the best leverage possible and reduce strain while turning. Tip 5. Avoid high-stress driving environments at first. No rush hour, no freeways, no long-distance trips. You're testing a system that's still healing. Now, I want to briefly mention something I often bring up with patients in this mid-phase of recovery. Once you start moving again, soreness and low-level inflammation tend to increase, especially when you get back to things like driving, basic errands, or physical therapy. That's where a recovery supplement like shoulder support can help support joint comfort and mobility. It includes turmeric, MSM, glucosamine, and chondroitin, ingredients designed to calm that daily inflammation that can build up when you resume activity. It's what I recommend to many of my patients, and I've included a link in the description below if you want to check it out. And of course, it's optional, but if you're noticing an uptick in soreness once you start driving again, it may help take the edge off. So let's recap. You can't drive while in a sling, period. You need to be out of the sling, have comfortable range of motion, enough strength to turn and react, and your surgeon's clearance. Returning to driving is a big deal, but it's not worth the risk if you're not ready. And no matter how tempting it is to test drive early, remember this: it's not about your comfort, it's about your control and reaction time. You only need one emergency to realize you weren't quite there yet. If this video gave you clarity, please hit that like button and subscribe to the channel. I've got new videos every week that help break down the shoulder recovery process in a way that actually makes sense. And don't forget, if you're just getting cleared to drive, you're probably also ready for a deeper dive into early rehab. Watch my video on the 5 truths in the first 6 weeks. I'll link to it in the description below. And remember, you're not behind. You're healing. One milestone at a time. Thanks for watching, and I'll see you in the next one.